Okay, something else that I really want to tell you guys about is those that are at greater risk for periodontal disease. So if you have a family history of periodontal disease, because it's actually passed on from one person to another, because it's a bacterial infection, so it might pass on by kissing. So if someone have it and the other person can get it, depending on the severity of it, it may pass on. Okay, and people who smoke or use tobacco also have a greater risk of having periodontal disease and other disease such as diabetes. Also, it's another great risk of having periodontal disease, because when the diabetes is not controlled, it result in gum disease, it result in bone loss. And also, once the bacteria is active in your mouth, it causes you to keep losing bone, and the more bone you lose, the more closer you are from losing your teeth. So that's why it's very important, because since it's a silent killer, for your mouth, not for your body, but it's a silent killer for your teeth, just like high blood pressure, that is a silent killer for the body. So it's very important that you take care of the mouth, so that you don't end up with no tooth or toothless. Okay, so it's very important that you take care of that. It is very important to take care of your mouth before it's actually too late. And to do a little recap on sign and symptom of periodontal disease, don't forget, like, bad breath is one of the sign of periodontal disease. If you feel like your breath, no matter what you do, it does not get better, yeah, that could be a sign that you need to see a dentist for any follow-up for overcome disease. If your gum is swollen, if your gum is very bright red, so that those are sign of gum disease. If you are bleeding gum when you brush your teeth and you won't stop bleeding, that's mean those are sign of also gum disease. And then another things is the packet, which you don't have access at home to control that, so you have to go to the dentist so that they can check the packet depth to see if you have gum disease or not. And if you see that your teeth are shifting, that's also a sign of gum disease. And if you realize that your teeth are getting looser, that's also a sign that you have gum disease. The reason why your teeth are getting looser is because you already lose so much bone. Those teeth most likely need to be removed. Okay, so those are the information that I have for you. I will see you next time for another video, and don't forget to subscribe to the channel so that you can see your hygienist talking about what's going on in the mouth. Thank you. Ciao, ciao.